We are here today with Dee, a patient here at IPC, and she's going to talk to us about her success story with IPC and what we've done for her. And then she's also here with one of our outstanding providers, Candace.
Hi.
Dee, if you want to go ahead and start out telling us what brought you to IPC, what worked, and then Candace, maybe you could go into, when she first started seeing you, the journey we took, and what ultimately worked for Dee.
Well, I started coming to IPC a couple of years ago because I was having severe neck pain and my range of motion was very limited. I was in a lot of pain. And so Dr. Binger did an ablation, which was very successful. So shortly after that happened, I fell at work and I injured my back. And I remembered the success I had had with Dr. Binger from my neck, so I decided to come back to Dr. Binger to try and get relief from my back pain. So I started working with Candace and Dr. Binger. We did epidural steroid injections, we did SI injections, and I would get relief for short periods of time, but nothing that was long term. And my symptoms were really starting to have an effect on my everyday life. We had a new baby in the house. I couldn't pick him up. I couldn't do anything with him. I was irritable a lot because I was in so much pain. And so working with Candace and Dr. Binger, we decided to do the mild procedure, which I had done July 12th, 2019. So I'm now exactly 1 month out from the procedure. And I feel like it has probably improved my quality of life so far about 80%. Every day is an improvement from the day before. I had hoped for overnight success, but that was like just my own little dream, because that's just the way I am. Then once I got it through my head that this wasn't going to be overnight, it's going to be a gradual process, I was willing to be patient and wait for it. So like I said, it has been a very gradual process, but every single day I see a difference. Things that are 100% resolved are the weakness and numbness in my legs. I don't have that at all anymore. Pain in my hip that was constant is now completely gone. The pain that I'm experiencing now, which I would not even describe as severe pain, it's discomfort, is more from the incision site, and that is improving every day as well. So I'm trying hard to follow my instructions and not do my weightlifting restrictions and things that would overtire my body, because I hope that within the next month I could probably sit here and say 95% successful. I'd love to say 100%, and I don't have any reason to feel that it can't be 100% successful.
Gosh, I don't think I can even top that. She answered pretty much everything. So I met Miss D as a patient, awesome patient, and she came to me initially saying, I need medication. For now, she didn't tell you this, but she's a waitress, right? And so she's in a high-paced job that requires a lot of demand. And she said, I need some meds just to get me through this. I don't want to be on these meds long term. So like she said, we did epidural, something to try to get her through. They were working at one point in time, and it's just, like she said, slow, gradual decline to where nothing was really working for her. And her goal was to just be off of her medication. So we have been talking about this mild procedure for about a couple of years now, I think. And we were finally able to get Dr. Binger privileged to get him done at Austin Memorial, and it was like, yay! I had this big long list of patients that had just somehow got lost, and just so happened Dee and I were talking about it, and I was like, hey, I think this is a great thing for you. Let's try it. And she's such a get up and go person. Let's do it right now, Candace. Tomorrow. I'm like, no, Miss D, we got things that we have to do first, and she met every requirement. She was like the perfect patient for it, and literally came back to saw me a week later, and she was amazed when she woke up from the table like, oh my gosh. She's like, this is amazing. Her life was great. One particular adjustment that most of my patients probably wouldn't have to make, because most of my patients are not working, they're retired, is that for her particular case is that we had to put some restrictions on her for work, unfortunately, you know, because she is a go-getter, but her boss knows that of her and like demanded a lot of her. So I had to put some weight restrictions, some lifting restrictions on her. But we took this journey together, and it turned out to be a great journey. And now she's so high strung, she's ready to get off her meds already. You know, and it's good, you know what I'm saying? But I just told, you know, slow and steady wins the race. And I mean, I'm with her on that road to recovery, and that will be our next step. And she's hoping that this month, the medication is her last month that will be prescribed to her. And so I'm happy as this is our first success. I'm going to claim it for our outpatient procedure.
Candace
so.
gets all the credit for this.
Well, thank you. I
Well,
appreciate
maybe
that.
we could let Dr. Binger have.
Yeah, we can let him have a little bit of it.
Little
Yeah,
bit.
just a little bit. Yeah. So.
But-
All right.
So, well, thanks for sharing your story, Dee, and thanks, Candace.
Well, thanks for listening to us.
Well, and I do want to thank you sincerely, genuinely, because you have so much given me my life back.
I appreciate it. We
Bye.
gotta give Dr. Binger some credit, though.
Do we?
Yeah.
Oh, okay.
Yeah,
All
we
right,
do.
Dr. Binger
Okay.
can have some
Yes.
credit.
Dr. Binger, yes.
Thanks, Dr. Binger.
Yes, Dr. Binger.
You're really cute in scrubs.